As a back office assistant, your duties will entail acquiring diagnostic studies for the patients you see. There are two types of studies that we use, X-ray and ultrasound. Depending on the patient's chief complaint, you will need to prepare the physician with initial diagnostic studies to help make his job of diagnoses and treatment fast and efficient. Most of the studies you will acquire will be from your initial H&P taken at the moment of intake for the patient. Most of the new patients will need a study, and any patient who has had new or ongoing problems that has not been resolved will need a diagnostic study performed. In the later tutorials, we will talk about the protocol for post-operative patients, which require you to take a set of X-rays to ensure the bone placement and healing is sufficient.
The purpose of taking an X-ray is to be able to visualize any inconsistency in the bony structures of the body. The X-ray machine will emit a beam of radiation to the body part of interest. The less dense tissues of the body, such as ligaments, tendons, and any other soft tissue, will allow the radiation to pass through and strike the plate behind it. The denser structures, like very thick tendons and bone, will absorb more of the radiation, thus allowing less of the radiation to reach the plate. The denser structures will look much more white on the X-ray film, while the less dense structures will allow more radiation to pass and show up darker on the film. It is this concept that allows the physician to see any breaks or inconsistencies in the bone, because there will be areas where radiation may be able to pass more or differently than normal bone structure. Likewise, an increase in tissue density may also be seen with a whitening of the soft tissue surrounding the area. Although X-ray is excellent for bone deformity, it is a poor indicator for soft tissue problems. Though thickened tissue may show up, there is not a clear way to see what is causing the problem. To visualize problems within the body that are of a soft tissue nature, we use the diagnostic ultrasound machine. The concept of an ultrasound machine is that it sends sound waves at a very high frequency into the body part of interest. As the sound waves come in contact with the tissues, they bounce back towards the machine at various rates depending on the architecture of the tissue. This allows the machine to recreate a three-dimensional picture based on the echo effect of these waves. It is a real-time process that allows one to visualize what exactly is happening at the moment of the ultrasound. The physician is able to see much greater detail within the soft tissue regions of the body. This allows our physician to visualize any bleed or tear within the ligaments, tendons, muscles, and vessels of the body. We will now go over the steps and process of taking an X-ray as the back office assistant. Depending on which office you are in, the concept is the same, though the steps will be different. This tutorial will explain taking foot and ankle X-rays in the Centralia office. The Centralia office uses a manual X-ray machine, which consists of a wall unit, where you will find the power button and all the controls necessary to change your exposure time. The floor pad, which is attached to the floor and has with it the actual X-ray head that will send the radiation wave. The lead apron on each patient. This is a gonadal shield to protect the patient's sexual organs from any type of radiation. Now, you will need to place the X-ray head directly above the foot. Then, slowly bring it forward toward you until the degree indicator on the side reads 15 degrees. Press the light button found on the front of the head to light up the area, and make sure your patient's foot is within the light. There's a black hollow circle within the light that will show up when the light is on. This is an indicator for the middle of the beam. Place this middle of the beam indicator in the middle of the foot so you ensure proper placement. Whatever is in the light will be radiated, so make sure you calibrate the beam to fit only the part of the body you want. When the light rests right and your patient is in place, you will then need to go to the wall-mounted portion of the X-ray machine and calibrate your pulses. The pulses is the exposure time to the radiation wave. For an AP, you will type in the numbers 006. When this is complete, tell your patient to stand still and go to the room behind the X-ray machine, where you will see a black button on the wall. Press and hold down the button until you hear a beep. When the beep goes away, you may stop holding down the button. You've just taken an AP view of the foot. Now that you've taken the AP view, you'll take the lateral view of the foot, using the same plate that you used. To take a full foot series, you're ready to learn the last two basic views for the foot. The first is the sesamoid axial. There are two bones that sit under the first metatarsal phalangeal joint, called your sesamoids. These bones act much like the patella in the knee. They hold the tendon that causes flexion in the joint farther away from the joint, which allows the foot to handle the movement and tension better in that area. Certain mechanical and structural deformities can be diagnosed depending on where these bones are sitting under the joint. A very common deformity is that of hallux valgus, or more commonly referred to as bunions. When a patient comes in complaining of pain in their bunions, this is a view you will need to take. It will often replace the third oblique view of a normal foot series. To take a sesamoid axial view, you will then need to set up the special platforms made for taking a sesamoid axial. There are two sloped regions designed to elevate the toes and heel on these special platforms, while allowing the joint of interest to fall down towards the platform. These special platforms are labeled left and right, so you will place them with the small immovable slant up against the cassette and the larger sliding slant towards you. Make sure the larger slants are even on left and right, and they are slid up open enough for the toe joint to sit in. You will place the L and R side by side and take them both on the same cassette. Have the patient stand on the platforms with their toes up to the cassette and pull the X-ray down just like a lateral. You may need to adjust the neck of the head so that it is lit up fully. Make sure the black dot from the light is situated between their feet, the light covering the whole cassette. The pulses will need to be adjusted because this is a denser shot, so you will adjust them to 0, 1, 0 and take the view. And finally, the last of our special views is the calcaneal axial. This view allows the physician to visualize the heel and check for any fracture or spurring that may occur. This view is shot much like the AP, except you will not need to partition off the cassette, and the angle, instead of 15, will be 45 degrees on the X-ray head. You will prepare the cassette by placing the name label and left-right indicator in position. You will then lay the cassette flat as an AP and have the patient turn with their back towards you. Have the patient place their foot in the middle of the cassette and bend their knee forward while keeping their heel flat on the cassette. This allows the joint to be open and a better visual of the ankle and calcaneus to be seen. The pulses will be set much like the sesamoid axial at 0, 1, 0. Now take the X-ray. With the knowledge to take these 5 views in your arsenal, you're now ready to obtain diagnostic X-rays for any foot concern. Now that you've learned how to take a foot X-ray series, we will focus our attention on taking an ankle series. As the foot, there are 3 views that you will take whenever you get an ankle series: the AP, lateral, and oblique. Unlike the foot series, however, you will set up the cassette the same way each time, and you will use 1 cassette per view. There is no need to partition off a side. To prepare the film and platform for taking an ankle view, you will need to make sure you place the cassette in the farthest slot back, but this time, instead of long ways, you will place it so that the long side is pointed up. You will not need to have a cassette holder. To take an AP, you will have the patient stand behind the cassette and bring the foot of concern forward to the front of the cassette, while the other foot remains behind. Have them place their leg and foot in the center of the film and heel up against the film. For the AP, the toes will be facing toward you. Make sure the light of the head is encompassing the entire cassette and the black dot is in the center of the ankle. You may need to adjust the neck. Set your pulses for 0, 1, 0 and take the X-ray. To take an oblique ankle view, you will set the film and X-ray machine up exactly the same as the AP. The idea of an oblique is to open up the ankle joint and sinus tarsi so you can see a different angle. To accomplish this, you'll need to rotate the foot ever so slightly medially, or towards the big toe, so that the lateral and medial malleolus are exactly parallel with the cassette. You will then make sure to set the pulses at 0, 1, 0. Take the X-ray. To take a lateral view of the ankle, set up the X-ray machine just as the AP and oblique. This time, position the patient like you would for a lateral foot, with the foot of interest on the side of the cassette facing you and the other foot behind the cassette so they are straddling the cassette. If it is possible, try to get the whole foot in the view. Then you can also get a lateral foot while taking a lateral ankle. If this is not possible, make sure you at least have the entire ankle and heel in the shot. Make sure the name label and left-right indicator are on the cassette on each of these views and take your view. The pulses for this will be 0, 1, 4. You are now able to take an ankle series for any ankle concern you will come in contact with. X-rays in the Centralia office, we'll focus our attention to the Tumwater office. Our Tumwater office uses a digital X-ray system. This makes the work of taking X-rays much easier and cuts the need for a developer, films, and multiple cassettes. The system is computerized and is run by a laptop found at the nurse's station next to the X-ray machine. The X-ray machine consists of a wall unit, much like the unit in Centralia, although this unit is to be turned on only. The calibration of pulses is not necessary because it has been taken care of through the digital computerized system and has already been done. The only thing you'll need to worry about on the wall unit is the power switch, unless directed otherwise by the physician or your trainer. The X-ray platform is set up so there is a digital cassette attached to it. It has two different placements. The first is a see-through portion of the platform, which the cassette can be slid under to take your AP and oblique foot views. The second is either side, which has slider sections that open to create a slot where the cassette can be loaded into sideways to take all of your ankle shots and lateral foot view. All of the same rules apply to taking the ankle and foot series in Tumwater as they do in Centralia, but you do not have to worry about labeling the patient name or left-right indicator. This all occurs in the program and will be explained to you shortly. What will stay the same is the positioning of the patient and the angle the views are taken. We'll now discuss quickly how to set up the platform and X-ray head to meet the angle requirements for each shot. To take an AP foot, you will have the patient stand on the platform while the cassette is under their foot. Make sure only the foot of interest is in the blackened area. Within the blackened area of the cassette, you will see a light blue bullseye, as well as guidelines around the edges. You will want the patient to position their foot so that they are directly within the guides and their foot is centered on the bullseye. You will orient the head of the X-ray machine to be directly over the foot, but instead of being able to pull the head forward, you will notice the head can only tilt from side to side. To create the 15-degree angle, there is a pull pin located on the right side of the head. Pull the pin and gripping the head at the bottom, pull towards you and up until the pin clicks into the next hole. As you will see labeled on the side, this is the 15-degree setting for the AP view. Press the light button to make sure the black circle is covering the foot and that the entire blackened area is lit up, and take the view. After you've taken the AP, keep the patient in the exact same spot. They are already lined up and the cassette is in a good place for the oblique view. Adjust the head by changing it from its 15-degree angle to the normal angle. To do this, if set in the 15-degree angle, pull the pin, and this time gripping the bottom, push down and away from you. This will put the head back into the regular 0 degrees hole. You will then need to push the head to whatever direction will make it point to the outside of the patient's foot. If you're taking a view of the right foot, you will need to push the head to the right. If you're taking a view of the left foot, you'll need to push the head to the left. Use your angle indicator and put the head at 45 degrees, as noted previously in taking x-rays. Make sure the whole cassette is lit up and the black circles in the middle of the foot. When this is complete, you may take the view. To take a lateral foot and all ankle views, you will need to adjust the cassette. For calibration reasons, you will need to open the slide out on the right side only. Do not use the left side slider. When the right side slot is open, you will carefully pull the cassette by the handle out of the middle area and place it in sideways in the slot, so that the black exposure side of the cassette is facing the patient and the handle is facing you. When this is in place, you will make sure the head is tilted to 0 and then dropped completely to the left side and down as a normal lateral view is shot. Make sure the beam completely illuminates the cassette and the black circle is on the middle of the foot. You will then position the patient as before mentioned so you can gain access to their lateral foot